Okay, observation hours. I can't believe we're already at 45 minutes. Are you guys doing okay energy-wise? Are we good? Go ahead and type in the chat box if you're like drained. I'm hoping that you're getting excited and you're being energized and you've got some stuff to start working on. But yeah, go ahead and drop in the chat box. I'm going to take another swig real quick. Just wet the whistle. Okay, perfect. Good. Energy's good. All right, observation hours. Okay. I need to have 1,000 hours to be a competitive applicant. I don't know where this number came from. Okay. Good. Everybody's doing well. Thanks, guys, for staying engaged and staying dialed in. We're on the home stretch here. So observation hours miss. I need 1,000 hours to be a competitive applicant. Not true. It's just not true. Because of COVID, I don't need to try to get observation hours to learn about the profession. Lazy. I don't like this mentality. Okay. I can't get observation hours due to COVID precautions, so I shouldn't apply. Also, not a good idea. Please don't do this. Please don't discount yourself if you're in an area. Like, I feel like the vast majority of the country now is the turtle's coming out of its shell a little bit, and we're starting to have an easing of some restrictions, and there's going to be more opportunities for people to get in, but there's some regions of the country that are still locked down really tight, and so applicants can't get in. But in general, don't give up just because there's COVID restrictions, okay? Observation hours can't make up for weak points in my GPA and GRE. If you follow my channel long enough, you know that I look at if you can be weak somewhere, you can be strong somewhere. Just because you're weak with your GPA or your GRE doesn't mean that your observation hours can't help you. So let's dial into this a little bit more. Okay, so COVID sucks, but don't give up. Okay, the number one way that I've seen applicants be successful is come in and share with clinics what can you do for them to make their lives easier. I'm telling you this now. So I forgot to talk about this earlier, but I'm a multi-site clinic director. My full-time job is I'm a multi-site clinic director for ATI Physical Therapy here in Arizona. Shout out to the Casa Grande and Maricopa clinics, doing awesome. And I can tell you that disinfecting equipment is one of the biggest pains in the butt right now. So ATI currently isn't allowing people to come and observe, but if I could have someone come and shadow and they would just help me clean off equipment and then watch over my shoulder while I'm doing stuff, oh, that would be amazing. Offer to come in and help, do laundry, disinfect, do things just to be helpful instead of being like, hey, I need observation hours for PT school. Can you help me? Say, hey, yes, I need observation hours, but I would love to come in and help you guys disinfect your equipment, to help any way that I can to make your lives easier so you guys can just focus on your patients and getting your notes done, right? Perform a virtual PT interview to learn about the profession and to learn about settings, right? Like if you can't get into an inpatient setting right now, at least try to reach out to an inpatient PT and ask if you can interview them, okay? There's a section in the application where you can enter, like, this is how COVID messed up my application. And you can put in there, despite the fact that I couldn't get into an inpatient setting, I was perseverant, and these are the things that I did to show that I really care about the profession and I want to learn about it. So do interviews, reach out to inpatient PTs, see if there's a way that you can talk to them or maybe meet with them outside of the clinical setting to interview and get to know them and ask questions and pick their brain. You can research current events on the APTA's website. Start looking at how has COVID changed PT, right? I think a lot of people have seen the value of mobility, helping people to be active as they're recovering from COVID. PT has taken a step forward in terms of our need in the healthcare system. Okay, so if you can get observation hours, which I believe is the vast majority of applicants right now, please don't put your head in the sand and just pretend like you don't need to get hours. You need to. The expectation's there. And let me put it to you this way. Let's say I have two applicants that are equal. Okay, they have the same GPA, the same GRE scores, and one of them has observation hours and one of them doesn't. Which applicant would you pick? Probably the one that has hours, right? Because it shows that they've been committed, they've worked hard, and obviously it all depends on what's going on with that other applicant. But if everything else is equal, they're from the same state, they have the same everything else, and one of them has observation hours, I'm going to go with the one that has observation hours. I don't know about you, but that's just me personally, okay? So my golden rule is it's not about the quantity of hours. It's about the quality of hours that you have. So some of you can't get jobs as a tech or as a rehab aide or whatever, okay? Whatever they call them in the state that you're in. So my recommendation is you get 300 to 500 hours in 4 to 6 different settings. So it's called the 3-5-4-6 rule. Okay. And those different settings include outpatient, inpatient, home health, peds, neuro, right? You're observing different patient population types. And as long as you have a diversity of hours, that's better than if someone has 10,000 hours of outpatient orthopedics, right? As opposed to the applicant that's listed in the PowerPoint slide, someone who has 300 hours of outpatient ortho, inpatient, pediatrics, and home health. Who do you think has a better idea of the full scope of PT? The person who has a broader diversity of hours. So I'm telling you this as someone who is, when I was at NAU, when I was at Northern Arizona University, I helped interview applicants coming to the next, who are applying to the next class. Okay. And the thing that made my professors and alumni clinicians who were helping interview more excited was if they had diversity and they'd been in inpatient, they'd been in skilled nursing, they'd been in more unique settings, and they've seen, like a vestibular clinic, or they've seen like hippotherapy, or they've seen aquatic rehab or home health, right? Like just go somewhere and leave no stone unturned. Try to look for unique experiences and try to find those instead of being like, outpatient ortho is easy. Everyone's gonna get outpatient ortho, and that's where the bulk of your hours probably are gonna be. But then go out and try to get 20 to 30 hours in more unique settings and then roll from there. Okay. All right. So, action items. If you have observation hours, you should have a log that has every hour in it. So, you know your numbers, you know where you stand. Okay. You need to start reaching out to the PTs that supervised you when you were there and make sure that they remember you and they are willing to verify your hours within the next few months. Okay. Because once you enter your hours into PTCAS is you have to get your hours verified. I recommend that everyone get their hours verified, regardless, right? Like you should have a licensed PT saying, yes, this person was here, because otherwise it just looks kind of fishy if your hours aren't verified. Make a game plan to obtain as many hours you can in as many settings as possible. If COVID's preventing you, contact the programs you're interested in applying to and ask them how they are accommodating applicants who are unable to get observation hours. Okay, that's the number one recommendation. If you can't get observation hours, do your research, identify all the programs that you want to apply to, and then email them and say, hey, I'm doing everything I can to get observation hours, but right now I currently am unable. How is your school viewing this type of situation for other applicants? Okay. And remember guys, diversity is more important. So the quality of hours is more important than the quantity of hours. All right, I got a question. Let me pull this up. What if you get 3 settings in the same place? That's fine. As long as you're observing different patient populations, like I'm assuming, Ritu, you're talking about you have you're in like a hospital system. So you can do like inpatient, outpatient, like neuro, pediatrics. It's like all attached to a hospital network. I'm assuming that's what you're talking about. But yes, that's totally fine. You're in a different specialty within the same hospital setting. That's just fine. It's just fine.